Yeah, I think I read that you guys had started your what's the Bright Tree? Y'all started that
The Big
recently?
Tree, yeah.
Big Tree, Big Tree.
We're coming off a huge week. We launched Tuesday. We had a grand opening, big open house. We had about 200 to 250 folks from the community coming in the pharmacy to meet
Wow.
the providers.
Oh, wow.
We had a taco truck, we had cupcakes, we had a big event and prizes and giveaways. So we're exhausted this week,
Nice.
but it was
That's how you do it,
really
everybody.
been
Just
good.
letting you know. The taco truck. That's how you
hang
do
on. Let's back up a little bit. So for
taco truck.
the
That's how you do
listeners
it.
and viewers who did not stop by the CPSN booth at Cardinal or Amerisource this summer, that's where I got introduced to Big Tree, was they were in your booth. So what is Big Tree? Explain that one.
Absolutely.
For anybody who has not come across this, because it was really cool when they explained it to me.
Yeah, the easy thing about Big Tree is it's convenient healthcare. So Big Tree is partnering with community pharmacies to embed practitioners so that when patients that you're already taking care of or patients in the community that don't have maybe easy access to primary care options, they can come to your pharmacy and be seen for regular primary care services or other types of enhanced services. So here at our site in Moose Pharmacy in Monroe, we're doing a spinoff of some more wellness types of activities. So IV hydration, different types of just wellness types of services that Liz, who is my the physician assistant that's working here, she's awesome and she's so motivated and has such a passion for wellness. So in addition to primary care services, we're going to have a whole new offering in the community that we haven't been able to offer before in the community pharmacy.
So if they're not seeing patients, what are they doing in the meantime?
Right now, we're growing the business. We're just trying to market to make sure, because we are so new in the community, and it is it's a subscription model, but it's very
so it's all
subscription.
So outside the subscription, I don't have primary care, right? So everything of the Big Tree in the pharmacy is subscription, and that's how does that work?
Yeah, so you pay a minimum of 3 months subscription. It's very minimal for us. Our price point's $70, and you have 24/7 virtual or physical on-site care. And you can see the provider every day if you want. That also includes a handful of about 180 medications. So if you're seeing the prescriber feels like there is something you need, she'll write it, and it's covered under the subscription cost.
Okay.
And not only, so that $70 not only includes the visits with the physician, there's some drugs that are covered. Tell us about that.
Absolutely. So there's, as a partner with Moose Pharmacy, as the membership costs, there's 180 medications, mostly generic medications. And I think they're pretty comprehensive for almost every disease state, every acute need that you may have. There's something there that can be treated. And so for patients that are concerned about cost, they can be taken care of very well under the subscription model.
Very cool.
And then, all right, so the stuff that's outside of that 180 drugs, is that normal cash price, or is it some kind of cash plus, or what is that?
Yeah, so that would be, for services, there's the subscription plus, usually it's a discounted price than what you would get into like the marketplace. So if you have IV hydration, a need for that, then you could go ahead and get that, but it would be cheaper than if you were just going to go to another location for an IV hydration treatment because they paid that subscription.
So it's 180 drugs included, and then there's some other drugs that are cheaper than you could get just walking off the street and getting them. So that's
yes,
okay.
Absolutely. Absolutely.
So the services are like, what am I thinking? It's chronic or acute? It's acute.
It's acute.
So I'm walking in, I have a problem, right?
Yeah.
What about preventive services?
Yeah, absolutely. So there is preventative, there's chronic, and there's acute care management. Anything you would see your primary care or an urgent care for, this would be what you would come.
So I want to come in and get my flu shot, and I decide, hey, I want to get started on birth control.
That's easy. Well, we could even do that in the pharmacy side in North Carolina anyway.
Yeah, y'all can do that in North Carolina, because that was the recent, we talked to 2 girls that work for y'all they were doing their internship at the time,
Yes.
and they were working on that program. So, but getting established in other states where, like, so how does that work? Explain that to me. So you got it, you guys got it passed in North Carolina, but what about other states where they had, like, you still have to go to an actual doctor office for the Tamiflu test and prescription side of it?
Right. Yeah, I think it's only a matter of time, right? I mean, access to care is a problem all over the nation.
Right.
And for the states that haven't passed it yet, I think it's a matter of time before there's going to be that type of access available. You know, we're lucky in that I would say maybe more of the middle of the road states that have been able to pass it in North Carolina, but there are other states, Washington and Colorado and others, that have just been the front runners of those kind of activities and have a very strong pharmacy legislative presence that have been on top of that for a couple of years now, even. So we're kind of following their trail and those types of services and scope of practice rights.